I was recently asked by someone for information on schizophrenia because they had a family member who was diagnosed and they wanted to better support them. So as a result, I'm doing this episode so that we can all be a little bit more educated on the topic. Welcome back to Savvy Psychologist. I'm your host, Dr. Monica Johnson. Every week on this show, I'll help you face life's challenges with evidence-based approaches, a sympathetic ear, and zero judgment. Schizophrenia is a chronic and severe mental disorder that affects how a person thinks, feels, and behaves. It's characterized by a range of symptoms, including things like delusions, hallucinations, disorganized speech and behavior, as well as impairments in cognitive functioning. So today we're going to be looking at our trusty DSM-5, which provides the criteria for the diagnosis and understanding of schizophrenia. And I'll review a few broad strokes with you today. So to be diagnosed with schizophrenia, a person must have at least two of the following symptoms for at least the majority of time during a month. At least one of these symptoms must be one of the first three that I'm going to mention. So the first one I'm going to mention is delusions. Delusions are basically strongly held false beliefs that aren't based in reality. So it can be things like believing you have superpowers or that the government or others are plotting against you. The next one I'll mention is hallucinations. So this is sensing things that aren't there. This can be things like hearing voices or seeing things. And third is disorganized speech. So talking in a way that is hard to understand or jumping from topic to topic without making sense. Another symptom of schizophrenia that I'm going to mention is disorganized or catatonic behavior. So with this, what you're doing is you're acting in strange or unpredictable ways or literally not moving at all. And that is the definition of a catatonic state, which is lack of movement. Other symptoms that may be present with schizophrenia may be reduced emotional expression. This basically means that you're not showing much emotion at all or no emotion. There's also something called abolition. So this basically means having little motivation to do things. We also have alogia, so speaking less than what is usual or what is typical for the average person. There's also a symptom called anhedonia. So this is not finding like interest or pleasure in things that you used to. And then you can also have a lack of sociability. So you just don't really have interest in social interactions. Those with schizophrenia may also experience cognitive symptoms such as impaired attention, which can lead to difficulty focusing. Also deficits in working memory. So this can really make people have trouble remembering information for short periods of time. You can also have impaired executive functioning. So someone with schizophrenia may have difficulty making decisions on their own and also understanding information. Schizophrenia often disrupts daily functions. So basically what this means is that after the onset of the illness, the person may struggle with work, relationships, and self-care compared to before they were diagnosed. Early treatment is crucial for improving the outlook for people with schizophrenia. So treatment typically includes things like medication to control symptoms and psychotherapy to help manage behaviors and thoughts. Support from family, friends, and community services is also essential. And just so that those of you who are helping someone with schizophrenia are aware, some common medications that someone with schizophrenia may take are Haldol, Risperdal, Zyprexa, or Seroquel, for example. Now, this is not an exhaustive list. This is just me giving you a few examples. Effective psychological and supportive services may include treatments like cognitive behavioral therapy, family therapy, social skills training, peer support groups, case management, and vocational rehabilitation. It's also important to note that schizophrenia can look different across cultures and between genders. Cultural background can influence the content of delusions and hallucinations and how people view the illness and its treatment. Men may exhibit symptoms earlier and may at times have more severe symptoms of schizophrenia than women, and women may have a later onset. Understanding schizophrenia is key to supporting those affected by this diagnosis. And it's important to know that ongoing research and new treatments continue to improve the quality of life for people with this condition. Being a reliable source of emotional support can make a significant difference in the life of someone with schizophrenia. The basics of how we do this is by showing empathy, listening without judgment, and also offering encouragement. One thing I always suggest to family and friends is to encourage adherence to treatment. Oftentimes, people with schizophrenia can develop mistrust or paranoia surrounding their treatment. That can sometimes be motivated by their delusions or their hallucinations. So doing things like offering gentle reminders to them about the importance of taking their medication and attending therapy sessions can help. I also encourage practical assistance. So this can be things like helping with scheduling appointments or transportation if it's needed. Other things that you can encourage are a structured routine. So you want to support them in establishing a daily schedule that includes time for self-care, social activities, and rest. Other things that you can encourage are a healthy lifestyle. So encouraging them to engage in activities that contribute to their overall well-being is key. So these are things such as regular exercise, a balanced diet, and also avoiding substances. At times, those with schizophrenia may need crisis interventions. So knowing the signs of a potential crisis and having a plan in place for seeking emergency help is necessary. You want to keep contact information for mental health professionals and crisis hotlines readily available. This can be as simple as texting 988 for a crisis if you notice that they may be a danger to themselves or someone else. However, I also encourage being aware of local resources as well as including the nearest ER to you. It's also a good idea to have the names and numbers of all the primary treatment providers. This can include their mental health therapist. So this could be a psychologist, a social worker, a mental health counselor, for example, their medication prescriber, which is most often a psychiatrist, but in some cases may temporarily at least be a primary care provider. And also, generally speaking, it's good to have their primary care provider's information as well. So for those of you who are already out here supporting someone with schizophrenia or another mental health disorder, do you have a favorite mental health resource that you'd like to share with those supporting their family members? Let me know. We can be a resource for each other. You can contact me via my Instagram at KindMindPsych or via my email at psychologist@quickanddirtytips.com. The Savvy Psychologist is a Quick and Dirty Tips podcast. It's audio engineered by Steve Rickyberg, with script editing by Brandon Getches. Our podcast and advertising operations specialist is Morgan Christensen. Our digital operations specialist is Holly Hutchings. And our marketing and publicity associate is Davina Tomlin. Follow Savvy Psychologist on Apple Podcasts, Spotify, or wherever you listen to podcasts. That's all for this episode of Savvy Psychologist. Thanks for listening, and I'll see you next week.